Hi, my name is Christina. I'm the student nurse, and this is Mai.
Hello.
Mai will be my patient today. So in this scenario, Mai is prescribed a beta blocker, which is going to lower his blood pressure and his heart rate. So we're going to be teaching him how to take his pulse today. So before I start, I want to ask a few questions. So the first question, is right now a good time to be learning this new skill? Are you in any physical or emotional pain that is going to distract you?
No, this is a good time.
All right, sounds good. So the second question, are you a auditory learner, visual learner, or a hands-on person?
I am definitely a visual learner.
All right, so since he is a visual learner, then I'm gonna remind myself to get him some written education later so that he can refer back to the teaching. And so the third question, what do you know about taking a pulse?
Not much. I mean, I know you check your wrist and you count your pulses, but that's pretty much it.
All right, sounds good. Well, that's a good start. So we're gonna move on. I've got two objectives for you, or two goals. So the first goal, after this teaching, you're gonna be able to explain to me how to take an accurate pulse. The second goal is after this teaching, you're going to be able to demonstrate how to take a pulse, and you're going to be demonstrating on me. Okay? Sounds good?
Sounds good.
All right. So let's move on. We're going to talk about what is a pulse. So a pulse is reflects how many times your heart beats in a minute. So every time you feel a pulse, it's because your heart is beating and then the blood is going through the artery, and that's what you're feeling. Okay? And so a normal pulse for an adult is going to be 60 to 100. And if you have a regular pulse, you're going to count your pulse up to 30 seconds and you're going to times that number by 2, which means a whole entire minute. If you have an irregular pulse, though, you're going to count it for 60 seconds, also for the whole minute. So you got two very common pulses that you can count from. You got the carotid, which is the soft spot underneath your jaw here. And you can feel that there, and then you also have one on your wrist, and in the groove of your wrist, and then thumb side right here. Okay, so I'm going to demonstrate how to take up your pulse here. Okay.
Okay.
So we've got a timer. We're going to set up for 30 seconds, and we will multiply that number by 2 to get his pulse. All right, so yeah, lay that here, and then I'm gonna make sure that I'm gonna find his pulse now, but I'm gonna make sure that I don't press too hard so I don't occlude his pulse, and I'm gonna make sure not to use my thumb because your thumb has a pulse of its own, and that can give you an inaccurate number. Okay. Alrighty, so I'm gonna start the timer now. All right, so at the end of the 30 seconds here, I got 40 pulses. So that means 80 in total for his pulse. And that's within normal range. Okay?
All right.
Awesome. So now I'm going to evaluate you. We're done with the teaching. And here is a brochure on how to take a pulse. So explain to me, how do you accurately take a pulse?
All right. Well, there are 2 areas in which you take a pulse. One, your radial artery, and second, on your carotid artery. You feel how many pulses, and you count for 30 seconds, and then you multiply that by 2, to make up a minute. However, if you have an irregular heartbeat, then you would want to count for the whole minute. What else? Don't use your thumb because your thumb has an independent pulse of its own, so that could really affect your numbers. I think that's it.
All right, awesome. That's very good. So now that you're able to explain how to take an accurate pulse, then you're going to demonstrate to me, and you're gonna demonstrate on me, and then I'm going to feel my carotid. All right, and then we'll see what numbers we come up with. All right, so let's get started.
You feel for your pulse. Alright.
Okay, sounds good. So, what did you get?
I got 35.
I did too. So that means my pulse is
70.
70. That's right. Good job. Congratulations. You know how to accurately take a pulse now.
Alright.
Alright. Cool. Thank you for being my patient.
Awesome. Thank you, Christine.
And thanks for watching.